You know that feeling when a slight chill just seems to penetrate right to your bones?
Yeah.
Maybe your fingertips get a little dusky in cooler air?
Mhm.
Well, imagine that sensation amplified dramatically, triggered by even mildly cool temperatures, to the point where your body's defense system starts misidentifying and attacking its own red blood cells.
Wow.
Sounds like something out of a medical mystery, doesn't it?
It really does.
But that's precisely what we're going to unpack today. Cold agglutinin disease.
Exactly. And it's fascinating. It doesn't just affect humans. It can happen in our pets, too.
Right, which is really interesting.
Yeah. So we're embarking on a deep exploration of this relatively uncommon condition.
Hmm.
Medically, it's classified as a type 2 autoimmune disorder.
Okay.
And our discussion today, it's grounded in, medical literature that gives a pretty comprehensive overview, mostly focusing on animals, but there are definite parallels to human cases mentioned.
Gotcha. So we're aiming to understand the basics, like what's really happening, what are the signs to look for.
Potential causes.
Yeah, causes, how it's diagnosed, treatment,
Yeah.
basically the whole picture for those affected.
Right. The goal is to get a clear, insightful understanding without getting totally lost in the super technical jargon.
Exactly. We want those aha moments where it
yeah.
just clicks.
Precisely. So let's dive right in. What exactly is happening in the body with cold agglutinin disease?
Okay, let's unpack this. So the central issue involves antibodies, those things in your immune system that usually fight off infections,
Right. The good guys normally.
normally.
Mhm.
But here, they become overzealous. They start reacting excessively when the body's temperature dips below a certain point, usually under about 99 degrees Fahrenheit, often even cooler, like below 88 degrees.
So it's like the body's security system just goes haywire when it gets a bit cold.
That's a great way to put it.
And what's really interesting is that these hyperactive antibodies, they specifically target the red blood cells.
Ah,
We call these rogue antibodies cold agglutinins, and the most common type we see is IgM, though you can also find IgG antibodies or even a mix of both.
now, the material we looked at mentioned something called thermal amplitude. That sounds a bit technical. Can you break that down for us?
Sure. Think of thermal amplitude as simply the temperature range where these cold agglutinins get most active. So ones with a low thermal amplitude start causing trouble at relatively warmer temperatures, but still within that, sub 99 degree range.
Okay.
These are generally the ones responsible for making the red blood cells clump together agglutinate in the small blood vessels, especially in the extremities when exposed to cold.
So that clumping leads to those circulation issues,
Yeah.
like the bluish color.
Exactly. That's what causes things like acrocyanosis, the bluish tint, and other symptoms in the ears, nose, toes, tail tips, places that get cold easily.
Right. Okay. So that's the low thermal amplitude ones. What about high thermal amplitude?
Yeah, those are less common. They can trigger chronic hemolysis, that's the ongoing destruction of red blood cells, even when the body temperature is quite close to normal.
Yeah.
But interestingly, sudden, really severe episodes of red blood cell destruction, they're usually not the main feature with most cold agglutinins.
Why is that?
Well, it seems to be because the complement system, another part of the immune system that helps destroy targeted cells, actually works better at warmer temperatures. So by the time the body warms up, the cold agglutinins often detach from the red blood cells before complement can cause massive destruction.
Ah, that's a really important distinction. So in most cases, it's not the cold itself directly destroying the cells.
Right.
It's the body's own immune response, triggered by these cold activated antibodies, that causes the problems, like the clumping and circulation issues.
Precisely. The body's misguided immune response is the primary driver.
So who actually gets this? Is it something common in dogs and cats?
Well, our sources say it's actually pretty rare in both dogs and cats.
Right.
And what's also interesting is that healthy animals can have small amounts of these cold agglutinins just circulating around doing nothing harmful, usually at a level or titer of about 1.32 or less.
So it only becomes a problem when the levels are much higher or the antibodies are more reactive.
Exactly. Or if they become active at slightly warmer temperatures within that cold range.
Right. It's like having a sensitive smoke detector that maybe chirps sometimes, but doesn't actually call the fire department unless there's a real issue.
That's a very good analogy. Yeah.
And do we know why some animals get it? Like genetics or age or breed?
That's still largely unknown in animals. The specific genetic basis, typical age of onset, breed predispositions, whether males or females are more affected. We just don't have clear answers on those yet.
Hmm.
But the sources do suggest it might pop up more often in animals living in colder climates.
Well, that makes intuitive sense given the cold trigger.
It does.
Okay, so if you're worried about your pet, what are the key signs? What should you be looking out for?
A really big clue is often a clear history of getting cold right before the symptoms started. Then, the classic sign is that acrocyanosis, the bluish or purplish color in the extremities. That's from the red blood cells clumping up and slowing down blood flow in those tiny skin vessels.
And what might an owner actually see on the skin?
You might notice redness, maybe actual sores like ulcers that can get crusty.
Ouch.
Yeah. And in more severe cases, unfortunately, you can see dry gangrenous necrosis, which is basically tissue death because it's not getting enough blood.
Where would you typically see that?
Usually the very tips, ear tips, tail tip, nose, the pads of the feet. And understandably, these areas can be quite painful for the animal.
Oh, definitely. And what about the anemia part, the red blood cell destruction? Is that always a major factor?
You know, the information suggests significant anemia might not always be a huge feature in every case.
Really?
Yeah. But you can see related signs, things like pallor-like, really pale gums or inner eyelids, maybe general weakness, lethargy, a rapid heart rate, which is tachycardia as the body tries to compensate, maybe rapid breathing or panting, tachypnea, sometimes jaundice, that yellowing of the skin or eyes, discolored urine maybe from red cell breakdown products, sometimes the spleen might be mildly enlarged, and occasionally a vet might even hear a soft heart murmur.
Wow. Okay. So it's quite a collection of potential signs that, especially with that cold exposure history, really start to point towards this.
Exactly.
So let's get into the why. What actually causes this? Why does it happen in some individuals?
Well, generally we talk about primary versus secondary cold agglutinin disease.
Meaning?
Primary or idiopathic basically means we don't know the underlying cause, it just seems to happen. Secondary means it pops up alongside, or maybe because of, some other illness or factor.
Okay, what kinds of other factors?
In cats, it's been linked sometimes to upper respiratory infections. In very young animals, something called neonatal isoerythrolysis, where mom's antibodies attack the baby's red cells, can play a role. Lead poisoning in dogs has also been implicated sometimes.
Yeah, poisoning. Wow.
Yeah, and also neoplasia, cancer, and of course, as we keep saying, cold exposure is that key trigger that sets things off in animals that are susceptible.
That's quite a mix of potential associations. And you mentioned earlier something about human cases and liver transplants. That sounded intriguing.
Yes, it is quite interesting. In humans, they've seen cold agglutinin disease develop in some patients after a liver transplant, specifically when they're being treated with the immunosuppressant drug tacrolimus.
Why is that significant?
Well, it just highlights the really complex interplay between our immune systems and, medical treatments. It suggests that sometimes altering the immune system might inadvertently trigger or unmask conditions like this.
Fascinating stuff. So how do vets, or doctors for humans, actually figure out it is cold agglutinin disease? How do they diagnose it?
It really relies on putting pieces together. First, that detailed history. Is there a clear link to cold exposure right before symptoms started?
Right.
Second, the physical exam, looking for those telltale signs, the acrocyanosis, the skin issues on the extremities. And then the crucial part is demonstrating those cold agglutinins are present with lab tests on a blood sample.
Yeah, I guess they have to rule out other things that might look similar, that differential diagnosis idea.
Oh, absolutely. For the skin signs, you have to think about, well, could it be something like cutaneous vasculitis, frostbite, other autoimmune skin diseases like pemphigus, maybe even certain infections or reactions to toxins like lead?
Lots of possibilities.
Yeah. And if there's anemia involved, you need to differentiate it from other causes, like maybe warm antibody hemolytic anemia, where the antibodies attack red cells at normal body temperatures.
Okay, so how do they specifically test for these cold reactive antibodies in the lab? What's the key test?
The key finding is seeing the red blood cells visibly clump together. That's macroscopic hemagglutination in a blood sample outside the body, so in vitro.
Okay.
Typically, you take a blood sample with an anticoagulant, like EDTA, and you see it spontaneously clump up at room temperature.
Right.
Then, importantly, that clumping should get worse when you chill the sample, say, down to around 39 Fahrenheit or 4 Celsius. And then, this is critical, the clumps should break apart, the cells should disperse again when you warm the sample back up to body temperature, around 99 Fahrenheit or 37 Celsius.
So that reversibility, clumps when cold, disperses when warm. That's the big giveaway.
That is a very, very strong indicator. Yes.
What about the Coombs test? I think that was mentioned in our sources too.
Yes, the Coombs test, or DIAT, is used, but the temperature you run it at is absolutely vital for interpretation.
How so?
Well, if you run it at normal body temperature, like 99 Fahrenheit, the cold agglutinins might have already popped off the red cells during the washing steps of the test. So you often need a special reagent, an anti-complement factor serum, to detect the evidence they were there.
Okay.
But if you run the Coombs test cold, say at 39 Fahrenheit, you can sometimes get a positive result even in healthy dogs.
Oh, really? Why?
It could be just non-specific binding of the test stuff, or maybe picking up those natural low levels of cold agglutinins that aren't actually causing any disease.
So it's not always a simple yes-no answer with these tests. There are nuances.
Exactly. And you can do further, more specialized tests like immunoelectrophoresis on the patient's red cells to figure out exactly what type of cold agglutinin is involved, IgM, IgG, or a mix.
And knowing the type helps with prognosis or treatment.
It can, yeah. It gives you a better idea of what to expect and which therapies might be more or less likely to work.
Okay, so we understand the mechanism and diagnosis. What does it actually look like if you examine the affected tissues under a microscope?
Well, the key findings are usually dermal necrosis, so death of the skin tissue. You often see ulceration, and because that skin barrier is broken, secondary bacterial infections are pretty common.
Makes sense.
And crucially, you'll often see evidence of vascular thrombosis, blood clots forming inside those small blood vessels. That's what directly leads to the ischemic necrosis, the tissue death from lack of blood supply.
So it's like a chain reaction. Cold causes clumping, clumping blocks blood flow, lack of blood flow causes tissue damage and death.
That's a very clear picture of the process, yes.
Okay, so how do we actually treat this in animals? What's the approach?
The immediate, number one most critical thing is usually hospitalization in a consistently warm environment. You need to keep them warm until the disease stabilizes and the symptoms stop getting worse.
Right, remove the trigger.
Exactly. Then supportive care is key. Managing any skin wounds depends on how bad they are. Unfortunately, if there's severe necrosis, say on a tail tip or paw pads, surgical amputation might be necessary to prevent bigger problems.
Wow, that's serious. What about specific medical treatments? Does removing the spleen help, like in some other immune conditions?
Splenectomy. Generally not considered very effective for the common IgM-mediated cold agglutinin disease.
Okay.
It might be considered in rare cases if it's Ig-mediated and the anemia is really severe and not responding to other things, but it's not a go-to.
So the main thing long-term is?
The absolute fundamental thing, and something owners have to really understand, is maintaining that patient in a consistently warm environment, lifelong usually, to prevent relapses.
Okay.
Exercise restriction is also usually recommended, especially while they have active symptoms.
And what about medications? Are there specific drugs used?
Well, the approach often depends on whether it's mainly IgM or IgG causing the problem.
Right.
For IgM cases, standard immunosuppressants, things like corticosteroids, leflunomide, cyclosporine, they're generally not found to be super effective. They might still be tried sometimes, but yeah, plasmapheresis is an option. That's where they filter the plasma part of the blood to try and physically remove those circulating cold agglutinins.
Okay.
And folic acid supplements are often given just to help the body make new red blood cells.
And if it's IgG, that's the main issue.
For IgG-mediated disease, then yes, immunosuppressive therapy is more the standard approach.
Gotcha. Are there risks with that?
Definitely. With any immunosuppression, you have to watch closely for secondary infections because you're dialing down the immune system.
Makes sense.
And another really important practical point, you absolutely must avoid using cold intravenous fluids during treatment.
Oh, of course. You wouldn't want to accidentally trigger the whole problem again while trying to treat it.
Exactly right.
So what's the long-term outlook? If an animal gets diagnosed, what's the follow-up like?
Well, like we said, that need for a warm environment is likely lifelong. The disease itself often starts quite suddenly, acutely, and can progress pretty rapidly in some cases. The overall prognosis, it's usually considered guarded to fair.
Not great, but not hopeless either.
Right. And recovery, when it happens, can take several weeks. It's not usually a quick fix.
So it really demands careful, ongoing management and just being super aware of temperature changes.
Precisely. It's all about diligently avoiding those cold triggers and giving consistent support to help the body recover and hopefully prevent it from happening again.
Okay, let's do a quick recap then. The key things about cold agglutinin disease. It's this unusual immune reaction where antibodies go haywire in the cold,
Right, targeting red blood cells.
leading to clumping. You see signs in the extremities that blue color, skin damage, maybe tissue death.
Mm-hmm. Diagnosis relies on history, the exam, and that key lab test showing reversible cold clumping.
And the absolute cornerstone of management is just keeping the individual pet or person consistently warm.
That's an excellent summary. It really does highlight how, seemingly simple things like temperature can have these really profound, unexpected effects on biology and the immune system.
Absolutely. Which kind of leads me to a final thought for you, our listener. What other seemingly ordinary environmental factors might have the potential to trigger surprising and complex biological responses in different individuals? It really makes you think beyond the obvious, doesn't it? About the hidden vulnerabilities within living systems.
It really does. A lot to consider there.
Thanks for joining us for this deep dive.